Hello friends, I'm Dr. Amit and I'm a plastic surgeon, and we are watching the hair transplant education series. This particular video is one of the most controversial videos I think in the entire series, and this addresses as to what are the problems of FUE technique. Now 90% of patients who come to us are already told by different sets of doctors, and unfortunately most of them are either dermatologists or homeopath physicians, doctors I mean, and they're the Ayurved specialists or dentists or MBBS doctors who have told this particular patient to do FUE. And when they meet me and then they hear the problems of FUE, they always ask, why did that doctor tell us about FUE and why are you not telling us? Dear friends, thank you for watching this video. Please like this particular video and subscribe to my channel. This will give access to all the upcoming amazing videos that we are going to put up, and also open up all the other videos that I have posted so far. So, in my view, the first problem with FUE is that whenever we want to do extensive hair transplant, big hair transplant, FUE can create problems because of thinning of donor area. The donor area can get really thin if we do extensive hair transplant. Second, sometimes we have to go outside the donor area in order to take that much hair. So we either go into the neck or above or in front of the ear in order to take the maximum number of hair, and this can cause problems because why? The density here gets very low. The scars of FUE are totally visible. Third, the hair may not be permanent. Any hair taken from outside permanent zone is not permanent. So as a patient, do you want to take that risk? As long as you're doing less than 2500 grafts with FUE, it is fine. Beyond that, it's a problem. And please understand, almost no plastic surgeon will ever tell you to do an extensive FUE or an FUE more than that number of grafts. Now, second biggest disadvantage, you should not be doing FUE in curly hair. In curly hair, the roots are turned, they're curled up, and FUE is done with a straight punch. The moment we make a punch hole, the roots are damaged. So if you've got very curly hair, why would you want to do a technique which can actually cause damage and less result? Whereas FUT is a technique which hardly causes any pain, recovery is very fast, the scar actually is much less than FUE. You have been told that FUE is scarless. Please do not believe it. If you don't believe me, just Google FUE donor area scar and you will be shocked by the scars that are visible. And in scars in some of our patients, in fact in most of our patients where we do FUT, you can barely even make out the scar. So don't be misled by doctors who tell you that FUE is better. FUE has a lot of problems and it's important that you understand it. Remember, FUE is a surgery. It should be done only by plastic surgeons and not by anybody else. Do not underestimate the problems of FUE.